Hello everyone, Dr. Kimball here. I'm going to answer a question for you today, which is, how do I know when I need to go see a spine surgeon for my back pain? Without answering that question directly, I'm going to share an experience, okay? I have people calling me, friends, family members all the time, asking me their opinion about, do I need to see you? Do I need to see someone else? I live in another state. Should I go see a spine surgeon? So this is an example of someone close to me, my brother. His wife is a marathon runner, super active, she's always run, but she's having more and more low back problems to the point where she's having a hard time running and having a hard time sleeping. And every morning when she gets out of bed, it's like an hour before she can even stand up straight. And so what do I tell him to communicate with her? He's also a surgeon. He's not a spine surgeon, but he's an orthopedic surgeon. So he's super educated as well. And he's coming to me for advice. So this is the backdrop. Pretend that's you and you want my advice. That's what I'm going to try to give you right now. So a little segue. There's a lot of things that you could, should, and need to be doing before you even consider this question, okay? So what can you be doing right now to take care of your back or to address your back? That are going to be questions that are going to be ones that I'm going to be addressing every time before at the beginning of a visit. So the most common problem that people have, and there's lots of causes of back pain. You can look at some of my other videos and where I get into what are the causes of back pain, but a lot of it comes down to, just pause for a minute. What typically happens when people start to have back pain is they've gotten too busy in a different area of their life. They never had back pain when they were younger, but they have started to decompensate their core, which is the soft tissues, muscles, tendons that are structurally supporting the spine. Now, the spine is constantly battling gravity and just the degenerative process of biology and your spine. And so when you were younger, you were doing more and you were not necessarily thinking about it, but your back didn't have any degeneration to it because it was younger. But now as you get older, a couple things typically happen. You stop paying attention to your core, you gain a little bit of weight, you're working, you got other priorities, family, kids, whatever, and your main priority is, earning money for your family or, succeeding in your job or whatever it is, but your health, your general health and your core health is not the priority. So when we don't give it any attention, we start to decompensate and we might gain a little bit of weight and that doubles the problem. So lack of attention to your core, not just your stomach, but also your low back. And this doesn't mean go out and do a bunch of sit-ups. It's probably the worst thing you could do, okay? So don't go do that right now. Weight loss, taking the weight off of your back is a huge focus. People always have a problem with that because they're having pain, and when they go out and do activity, they're like, okay, I need to go run if I want to lose weight. It's hard to run when your back hurts. It's like, well, I can't run. And then they just go home and they feel depressed and they gain more weight and the back hurts even more. It's just like this horrible spiral. You don't want to get stuck into that spiral, okay? So a lot of it is just what you eat, how you eat. And then the other piece of it is, cardiovascular activity, increasing your caloric expenditure, your burn. And then also, number 3 is addressing your core, okay? So all those things literally have to happen at the same time. If you're doing all those things, you've lost weight, and I'm not talking about I'm not talking about just a little bit, I'm talking about real weight loss to the point where your body fits your frame, okay? And I won't go into any more detail than that because everyone's got a different frame. So when do you need a spine surgeon? When do you need to go see a spine surgeon? If you've done all that stuff, if you've done all those things and the pain is persisting and you are doing less and less in your life, you're not enjoying things, you can't do your job. I'm not talking about, hey, you don't want to work your job because your back hurts. I'm talking you can't work because you're hurting so much. Those are the things, and you're having major functional decline, major modifications in the way that you choose to live and enjoy your life. Yeah, you need to get another opinion. And it might not be that you need to start with your surgeon, directly to surgeon. You can go to your primary care doctor. They can order some very simple tests that a radiologist is going to review, and it's going to tell them if there's any major problems, okay? Just some basic x-rays of you bending and extending will demonstrate whether or not your neck or your back, the bones are staying in alignment. That could be like a real structural problem that you might want to talk to a surgeon about. If you're having those symptoms, they may also want to get an MRI scan. That can be really helpful for someone with trained eyes, not just a radiologist, but actually a surgeon to look at. I would caution if you jump out and you're like, listen, I got back pain, I've only had it for like 2 weeks, I need to go see a surgeon right now, that I will clip and we'll. So if you've only been having back pain, and I'm really just focused on back pain, not like the leg pain. So that's like sciatic pain. That's like literally another discussion. I'll create another video on when should I go see a surgeon if I'm having leg pain. We're really just talking about back pain right now, okay? So if it's only been going on for a couple weeks, you don't need a surgeon. You don't want to talk to a surgeon, and heaven forbid you end up going and seeing a surgeon and have pain for 2 weeks and they offer you surgery, because you shouldn't have surgery after having pain for anywhere, just back pain for under like 3 months, period. That's like acute back pain until it gets past 3 months. And to be honest, it should be a lot longer than that, because there's a lot of things that you need to do. There's a lot of science out there that says, listen, there's all these X, Y, Z, 1, 2, 3, 4, 5 that you need to be doing, inclusive of physical therapy and all these other things that I'm mentioning that you have to do, you should do before even considering a surgical opinion. Now, a good surgeon is gonna check those boxes and make sure that you're doing them all. I can't promise you that every surgeon is gonna do that. I see like second opinions all the time from surgeons that are recommending these shotgun approaches to the spine. And when I say shotgun, it's like, well, if you hurt, you must need a fusion. That is like my goal in my career as a spine surgeon, is to kind of eradicate that and make sure that patients are not just getting, well, you hurt, you must need rods and screws in your back, because that is not the solution, okay? There's a lot of better solutions out there. I've talked about disc replacement. That could be a great solution for you. It might not be the right one, but regardless, there's a lot of stuff that you can be doing on your own, and hopefully that'll help avoid you from ever even having to think further about what's next.